All right, good evening and welcome to today's webinar. I'm Danae Hebert, the Healthcare Innovation Supervisor with Well Ahead, Louisiana. Thank you so much for joining us today. Please note that your lines are muted to prevent background noise. However, please feel free to enter any questions you might have into the Q&A box at any time during the presentation. Today's webinar is the second in our Telehealth and Practice webinar series presented by Dr. Ted Hudspeth, and it will talk about how to choose a telemedicine platform. If you weren't able to join us for the first session on January 14th, the session was recorded and is available on our website for you to view at your convenience. All of the sessions in this series are listed here. And they will be recorded and available on our website at walpen.org/telehealth. This webinar series is funded in part by the TxLaw Telehealth Resource Center. TxLaw is a HRSA-funded program at Texas Tech University designed to provide technical assistance and resources to new and existing telehealth programs in Louisiana and Texas. And TxLaw is partnered with us at Well Ahead to serve as the support representative for Louisiana providers. TxLaw is one of 12 regional TRCs across the US, and there's also 2 national TRCs, the Center for Connected Health Policy in California and the Technology Assessment Center in Alaska. The 12 regional TRCs and the 2 national TRCs form the National Consortium of Telehealth Resource Centers. As a consortium, the TRCs have unparalleled amount of resources to help virtual programs across the nation, especially within rural communities. And each TRC is staffed with telehealth experts who are able to provide guidance and answer questions. As telehealth continues to gain more visibility and recognition in healthcare, the TRCs will remain positioned to provide technical assistance, education, and resources. And with that, I will hand off to Dr. Hudspeth for today's presentation.
Well, I thank you very much. Let me get off a share here. I want to just highlight what you just went through with those resource centers. I encourage each of you to go to that website because that's a repository that will really carry you a very long way. That group is actually responsible for putting this together. And I can't tell you the insight that they must have to be able to pull all of this into one resource for you if you're trying to make a decision about moving towards a telehealth program in your practice. This is definitely the way to start. So if you feel like you don't have any support, oh my gosh, you've got a ton of support in both Danae and Tracy who are on the screen with me right now. I want to thank you both so much for inviting me to be a part of this massive project that you guys are doing to try and develop a telemedicine program that will allow providers to be able to reach out to their patients, for patients to be able to get the care that they need, and to really advance healthcare in all of our rural areas, which forever has been, lacking. So I thank you guys so much for that. And just thank you for letting me be a part of it. So let me see if I can get in here and get started. All right, I'm going to go through an overview. First of all, just a few things to kind of tell you where we're going today. There are many types of telemedicine, and the big differences are the real-time interactive type medicine, which is really where I have the most expertise in dealing with my practice. I mean, I see patients, that's what we do. And specifically, I really focus on the visual part, not so much the audio part. You can do telephone calls and stuff like that, but I'm really trying to do more of the visual interactive patient to physician type medicine. There's a store and forward type medicine where people can actually store different data, like say with a dermatologist, they could take a picture and send that in to the dermatologist. The dermatologist looks at that asynchronously and then makes a diagnosis and makes a treatment plan. And then the third is remote monitoring. This is a booming area right now where you can remotely monitor people's blood pressures, glucoses, et cetera. And that is that's going to be huge as our chronic medical care increases in the country with all the chronic medical problems that we have. So, but what I'm going to focus on is how do you see patients directly in your practice? And as I always talk about, opportunity is when demand outpaces supply. You know, that's where we are right now. There is huge demand to be seen, especially because of COVID. I mean, bottom line is we were thrust probably 5 years into the future when COVID hit. I had been working on a telemedicine pilot for my institution since late 2018 and had it working by late 2019. Had all the docs and nurse practitioners in my clinic, which there were 7 of us, doing telemedicine visits. Most of my partners were not doing very many of them, okay? I was trying to do it because I was doing the pilot. But we went from, in February, our system had seen about 200 patients through the telemedicine portal, and then COVID hit. In April, we saw somewhere around 50,000. So there's no question that this is something that when pushed, people will want to do. And once they do it, they love it. So when you're going to do this type of a thing, you really do have to involve everyone in your clinic. You need all of your clinicians to be on board with this. If you have people who are looking at compliance and regulatory type things, they need to be involved in it. The billing folks are going to have tons of questions. How do you get paid? What codes do you need to submit, et cetera? Your registration people, you know, because you may be registering patients differently or through a different workflow, et cetera. And that's different in the telemedicine world. You're going to have all your administrative people that need to do it, the people who are going to look at your finances, the people who are going to help with the marketing, et cetera. And of course, any IT staff that you may have. Now, you might be wearing all of those hats in your particular practice. I realize that small clinics, you know, you may be all of this. So that's why this resource center that is putting on this whole series is so important to you. You should reach out to these folks and just get more guidance as to where do you start. And that's what I'm going to try to start today, is really giving you a few nuts and bolts of how do you just get started and get into this business, okay? Because you should be able to do it, okay? I'm going to be going through kind of a bare bones approach, which anybody could do. And then I'm going to show you all the bells and whistles of where it can go and where it can lead to. So you will also need to think about your patient needs. You know, in the rural community, we have problems with bandwidth. And so you'll have to look at those particular needs in your particular population. And then, of course, you're going to have to go through all the litany of things to look at your software and your technology needs. And that's where all of your team will be able to help you out, okay? If you have a team, if you're not a team of one. So today, what I'm going to talk about is going to kind of go through 3 different areas, 2 big ones. I'm going to go through and look at the bare necessities. You know, what are the bare necessities that you need as a patient and a provider to get started in a telemedicine program? And as I said, just about anyone should be able to do it through this method if you desire. The second part, when I finish that particular part, actually, I would like to open this conference up to questions and answers. So please send all of your questions through the chat so Danae can field all of those. I want to stop at that point because I realize that not everyone's going to be able to go through the bells and whistles. And I really want to make this session about how do you just get started, okay? I don't think you have to start off with the Cadillac to have a program. I truly do not believe that. And I truly believe, because I've experienced using one of the bare bone approaches, I use that in my practice too, because I can't always connect with the bells and whistles to my patients. So I'll kind of give you what my experience has been, okay? The second part is I'm going to go through all the bells and whistles after we get all of those questions done. So we'll talk about some of the really cool things that I've been, I guess, blessed with to be able to experience and pilot and share with patients and do some really cool things. Okay. I just want to give you an overview of where this can really go and how you should be able to feel like a very competent provider in the virtual space. To me, that's a big question that a lot of providers worry about. They worry, can I really take care of patients like this? And I promise you, you can. So the more you do it, the more you get better at it. And then I'm going to provide you with a few resources after that. So let's see. Actually, Danae, we're going to do a little poll. So if you guys will look at this poll and click a button, I'm going to ask that this stay up for you until you do it, and then we are going to look at the results later on as we go through the process. So if you're currently providing telemedicine services, please select the service that you are using. All right. So I'm gonna go next here. Danae, are you still seeing that poll? Or that was only on my.
Yep, it's still rolling.
All right, good deal. All right, well, I just moved it off. Can you see all of my PowerPoint now?
Yep.
Okay. So we talked about the bare necessities versus the bells and whistles. So on the bare necessities, you need to think about what are your core needs that you have to have a functional telemedicine program. We'll go through that. And then on the bells and whistles side, these are the kinds of things that you really have when you have more of an integrated, like a dedicated note-taking platform, your billing platform, and all of that stuff is integrated together. That's where you can get some of these bells and whistles on automating some of your tasks, like getting people to sign up for consents, how your documentation flows, actual waiting rooms for patients online, and messaging features to be able to message patients directly, their health maintenance items, and accepting payments online, and other services like monitoring pressures and glucoses and things like that. So we'll kind of flow through all of those as we go along. So here's the bare necessities. We're going to start off on that. You have to make sure, obviously, your audiovisual performance is adequate. Broadband demands, like when you go to a vendor, you need to try and ask them, what are their minimum broadband demands? Some companies tout lower than others. Okay, so you need to ask that. And then you have to figure out, is it compatible with your hardware and software that you have currently in your office? And then also your patients, kind of think about what do many of your patients have that they could do this on. You have to make sure that they have a HIPAA compliant platform. That is exceedingly important. Right this minute, it's not, because we have waivers with the pandemic, but that is going to end. That will not be a forever thing. So you need to be thinking forward. If you're going to develop something, may as well start off on a platform that is going to allow you to scale up and keep going when all of that ends. And there's something called a BAA. I'll teach you about that. That should be in place to be able to guarantee that you're compliant in a HIPAA compliant way. And then, of course, you want it to be easy to use for the patient and to get the visit done. So you kind of look at the workings of, how many buttons do you need to click on? So when you go through that functional operation in dealing with a vendor, you can look at those types of things. So in your audiovisual performance, we talked about it should be good over low bandwidth. Preferably, it would work both through Wi-Fi, 3G, 4G, 5G, should be compatible with all of those. In my own platform, I tend to find that on my end, it tends to be better if I am on my cellular. When I'm doing it actually through my phone, I can do it through that. And I seem to get better service even where I am, okay? And you usually, for your business, you generally want to have a 50 to 100 megabit per second line. Now, that's what a typical business line is. And it's not because most of your platforms require this much, but in your practice, you probably have other things going through, a line. So you you're probably not just dealing with a telemedicine visit going in and out of your office through these lines. So that's why you kind of need to shoot for that. And that's a typical business line. If you're going to need to use Wi-Fi, now you can determine your bandwidth. Now you can do this for your regular wired things also, but you can click on www.speedtest.net and there's a little go button. And when you do that, you can see actually your bandwidth. How fast is yours going? And I did this at my house the other day. When I was plugged in, I'm getting 210 megabits per second. So I've got a good line coming to you right now. And then the second one that they do is the upload speed. And you can see I uploaded about 9.49. So you can check out your needs both through a wired computer or with your handheld, your phone. You can check it out doing that. You know, in my own clinic, we do have wired computers, but most of what I do is actually either through an iPad with my Wi-Fi or my phone. My phone works better with the cellular. I don't know why, but it just does. So you have to play with it a little bit. When you're looking at your software and your hardware compatibility, you need to use a platform that is compatible with your current hardware to save costs. Most folks have computers in their offices and most of those are going to work fine, okay? So if you have a wired desktop computer with a camera, then you're good. But you may have to install actually one of the small cameras. It's a USB camera, and those usually run about $25. So they're pretty inexpensive. We actually did do this in my own clinic. We had regular desktop computers in all of my patient rooms, and we backfilled them with these little cameras to be able to use those if we needed to. That actually did come in handy for us when we first went through COVID. We were able to have patients connect through these. Like if we were concerned, you know, they were quarantining, they were put in a room and could see us from one of our own rooms. We could do all of our HPI and determine, you know, if they were safe for us to go in ungarbed or not, you know, that kind of thing. So that was very helpful to us when we first went into the COVID problem. Of course, you can have a laptop. Most laptops have a built-in camera already. And then of course your iPhone, iPad, or Android device, all of these obviously have a camera in them, but they do have very good connectivities usually as long as your broadband is adequate. We talked a little bit about HIPAA compliance and security. We all know what HIPAA is, and you actually have to be able to display that to a patient, or at least document that and provide that to a patient. So having that available online when they log in and being able to click through that, that's pretty helpful. And the other thing is encouraging the patient to be in a private area. You know, we can do everything on our end, but it is amazing where people will log in from in the middle of their business and they're there for the anxiety or depression follow-up. So you really need to kind of, if you know that's what you're going to be talking about, you need to prompt them to maybe, you know, go somewhere a little more private. So it has been amazing to me where people will do that. I've even had people in the middle of getting their facial done and they logged into their visit. So you never know. So anyway, the reason we have all of this with the HIPAA compliance is that there are data breaches that happen monthly, and those are being tracked right now. For us, there are guidelines that provide for any provider that is transmitting public health information in electronic form, we have to adopt a privacy and security safeguard for these, and we have to make sure that those are provided for every patient. Actually, emails are about 50% of the cases of the breaches. And then the second most common is actually hacking into network servers. And why it's such a big deal is because the fines are huge for us. So if we're going to have increased access for patients and providers to meet online, we have to be prepared with, you know, some kind of an agreement or making sure we're using a platform that is providing for those laws, demands and things that we have to do. So I mentioned earlier a BAA. What is a BAA? So it is a business associate agreement. And it's basically a contract between you and your telemedicine platform that you will be using good conduct, so to speak, that you'll be doing the right thing to be able to protect information, or they will, right? So it requires that the company display or tell how they will handle any kind of data that's going through its centers. And that's an agreement that you can fall back on and hang your hat on, that you have if you were reviewed by some legal authority. And it basically outlines the liability and responses required in case of a breach. If your system were to be breached, if you're using their platform and you have a BAA, then you are, protected somewhat through that. And that's pretty important to have. So you can read all this legal language, but I gave you the gist of it. So right now we wanted to show what our poll showed. So it looked like 40% were using the Doxy.me platform, and 20% were using FaceTime. So the reason I wanted to do this poll was to see, who's in compliance right now with all of these thoughts. The Doxy.me they have an agreement, they have a BAA and that kind of thing, but FaceTime does not. So thank you guys for those of you who did share what you're doing. These are things you need to think about and make sure as you move forward with whenever they're going to change these laws, or the lack of them right this minute. We need to be prepared. Okay. So thank you for doing that. So some basic software examples. A couple of you are using Doxy.me. This is one we use in our office. So let me share with you what we do. We use Epic in my office, and Epic has MyChart, which is a portal for a patient. It's an app. And they've designed the video portion of this so that people can log directly into their app, and then I can log in on my end and it connects us, okay? Audio visual. Well, the beauty of that is I have all my chart there, all that kind of stuff, which is really nice. But sometimes the patient just can't figure out the app, okay? I mean, I've said sometimes it sounds like my nursing station is like a computer startup in California, because they're talking about downloading this and, all that kind of stuff. Some patients just can't do it. And Doxy.me is actually in my app. I can click on the patient's phone number, and they've designed it directly so it plugs right in. It brings up the Doxy.me app and pops me into that visit through Doxy.me. And in that platform, for those of you who have not used it, it basically sends the patient a text. And from there's another button that you can actually call the patient. And so while they're, and I often do have to call. So when I call, I have to tell them, I just sent you a text. Open that text up and click on that link. And so when they click the link, it carries them into the visit with me. Just about anybody can handle getting a text. It does amaze me sometimes that it's a little difficult and it's a little bit of a process sometimes for us to do it, but almost everyone can do that. And what's nice about having the ability to call them, I can kind of walk them through that process if there is a problem. So that has been a really nice system. And this is HIPAA compliant. It includes a BAA, and there are 2 premium versions for this. There's a $35 per month for individual providers and a $50 per month option for clinics. There is an ability to customize a waiting room with a logo, text and video, and you can offer they offer real-time customer support for file transfer. So if they had to transfer a file to you or something like that. And there are, as I told you, the text notification, that's for both you and the patient. So you can text the patient, you can go on and do other things. And when the patient does log in, it'll notify you. So think about this. This really doesn't take that much to do. That's not very expensive, and I think is a great option for people. I'm not here to try to sell you on Doxy.me, but I do want to very much highlight that this should be easy for folks if they truly want to do this type of a program, because there are good options out there. So there is on the patient's end, this is another big thing I mentioned about downloading. They have to download our app. Here, there's no app to download. They just click on a link that I text them. So that's pretty slick. And of course, it features the live chat. It's like a FaceTime video, directly back and forth visit, and it's customizable, as we talked about. This is me in a screenshot here. You see, I told you that my program will carry me directly into where I can call the patient, pulls up their number. This is my clinic number, so I'm not divulging anything. And this is the screen that comes up next. It shows my little picture in there so I can get pretty for them. And then it shows that I'm dialing. That's my telephone number if y'all need it. And next is actually from their website. It's a picture from their particular website. It shows what I see when I see the patient. There's one called TheraLink. Now, this is more specifically for therapists. It also includes, again, the HIPAA compliant thing and the BAA. And there are different tiers that you can join with that, but it's similar. And then Zoom. Zoom has a specific health related type product that they use. So it's Zoom for healthcare, okay, is what they call it. And their plan is $200 a month. It is HIPAA compliant, includes a BAA. And of course, the thing that I think stood out for them is that they try to operate in a very low bandwidth, or at least tout that. I have not experienced it. I've not used it, but that's what they tout. So again, I think that's one of the things, if I were in a rural area, I would be questioning highly as to, show me where that is, show me how that works. And they do have features for internal communication, such as meetings and trainings, and that's what we're using right now. So before we go on to bells and whistles, I want to see if Danae has any questions from any of you. Please, let's take a minute here and really kind of focus on this, because if anyone's just wanting to get started to do something, this is really where we can start. So do you have anything, Danae?
I don't currently have any questions here in the Q&A box, but we will give it a minute and see if people are typing, if we get any to come in.
Okay, that sounds good. I think I did want to share, I'd never had to go through this process as a clinic owner. I worked for a large institution. It was chosen for me and developed for me in a way, so to speak. So the tasks that you guys have in making these kinds of decisions are enormous. I can't even imagine what you must go through in being able to maintain a clinic and see patients, do the administrative parts, which I know many of you do. That must be very difficult, and it must be very scary, because it's your pocketbook that you're putting on the line when you do anything new like this. So I guess getting in as legally as you can, like we discussed with the BAA and the HIPAA compliant platform, that's critical, so you don't put yourself at risk. Doing it as inexpensively as possible and being able to interface with everything that you now have is critical. And those are probably the biggest points to start from when you're starting to choose a telemedicine platform. So anything there?
Nothing here. I guess you did such a good job. No one has questions.
Done a good job. All right. So what I'm going to do now is I'm going to go through some bells and whistle type things. And man, there's so much right now that's going on in this field. I've been blessed to be part of some of the discussions and thoughts of, what would be really neat in a program as we do telemedicine itself. And so I'm going to share with you some of those things that it gets me excited about doing all of this. So when you're thinking about this, I think about it in like a patient workflow kind of thing. So when you're thinking about it from that standpoint, you think about connection versus, an app versus web platform, things like that. You're looking at scheduling, can patients actually go online and schedule, that kind of thing. Is there a method for the patients to be taken in, basically checked in, so to speak, and go through an e-pre-check? So imagine if a patient logged into their visit and was able to input all of their history of present illness or their review of systems, do those kinds of things. So we'll talk about that. There's some automation of tasks that can be done. So for instance, getting them to consent to the visit. There are certain things about that. I talked about documentation or review of systems and things like that. Just imagine about waiting room amenities, like letting them know where they are right now, having nurses be able to pop in and things like that, being able to message them directly through all of that, being able to take payments, things like that, and other services. So let's kind of go through them. Let's look at it from the patient needs standpoint. So we have to make sure that our patients have compatible hardware and software to be able to do this. Now, if you're going to choose one with all the bells and whistles, it should be able to connect no matter what the patient wants to connect with, okay? They should be able to do it through an app or on the web directly. We should be able to customize some of those workflows that patients go through and the things that they may need to check the box or answer questions or consent to. We should be able to put those types of things into the program so that it is specific to our clinic. One of the things that I never thought about until they presented it was to have patients be able to upload pictures and vital signs to me. A picture tends to actually be a little better quality than a video coming to me. So sometimes I'll be seeing a patient, they want to, they're there for a rash. It may be better for them to send me the picture and then us do the visit. But the vital sign part, I'm going to go into that a lot. The vital sign has allowed, or capturing that has allowed me to be able to expand in a completely different area of medicine with chronic care management. That is very exciting to me because it's something that I was doing for free before. And now I'm able to actually get paid for that and do what I feel is better care in being able to take care of the patient. And then being able to text and email with patients through all of that. That patients love to be able to send me messages directly. It also frees up staff. I don't need to have as many phone staff, et cetera, dealing with things. So we've talked about the internet speed and connection. We have to think about our patients. For rural patients, I did find a statistic that 65% of rural patients have broadband access. Okay, so that's a big number. And I actually talked to someone from AT&T recently, and that works in the rural areas, and he confirmed that with me. He said that's about right. That's what he sees when working on the lines. We have to think about patient needs with Wi-Fi versus wired versus cellular. Again, a bells and whistle program should be able to do all of that. And we talked about the web browser and the apps. For connection needs within our clinics, for patients, 1.5 to 3 megabits per second is usually adequate for them to use most programs. Now that's pretty low bandwidth, okay? And most people do have that. If they have broadband, they at least get these numbers in the rural area, okay? So the US government has made recommendations on health centers, IT needs, and for smaller clinics, they suggested the 10 megabits per second because you're not doing maybe a bunch of doctors in the clinics. 25 would be helpful if you need to be doing real-time downloads, and of course 50 to 100 is what we had quoted earlier if you have a lot going through your clinic. You need to think about the video conferencing software or browser that you would be using. And of course, we talked already about the hardware needs, the cameras, the speakers, and all that kind of stuff. I'm going to talk a little bit, though, about these peripherals. So peripheral devices are things that you can track your patients with. So a glucometer or blood pressure cuff. And I'm going to actually show you one of those, what we are starting to use. So patient examination equipment. So we'll start off with one. The Withings company has one. It's a blood pressure cuff, and when the patient checks their blood pressure, it actually can upload to their phone, and then that can be linked to their account, and that actually uploads data to the chart. The same thing with a glucometer. That can be linked in. iHealth is one that's been used a lot and can interface. I'm going to show a little video here. Within Ochsner, we're using one called a Tyto kit, and they branded the Ochsner Anywhere Care Health Kit. You know, many of us worry about not having a great exam or an access to a great exam on patients, especially for respiratory things and stuff like that. So just imagine if you could see some of those things and hear some of those things on a patient. So let me show you what's coming, and we actually have this available now.
When your family is sick, you want all the information you can get. And we know getting to the doctor isn't always easy. That's why Ochsner Anywhere Care is now offering 24/7 on-demand medical exams with the Ochsner Anywhere Care Health Kit, powered by Tyto Care. With this new solution, you can now capture examination data from home using the Ochsner Anywhere Care Health Kit and send it to the Ochsner Anywhere Care app for review by your physician during a telehealth session. By adding physical exam data to your Ochsner Anywhere Care session, your doctor can more confidently diagnose and treat many of the most common conditions, such as ear infections, colds, sore throats, fever, coughs, congestion, and rashes. The system has an easy-to-use touchscreen that guides you through the examination process and special adapters for examining the heart, lungs, ears, throat, skin, and taking body temperature. Let's see how it works. Michael's woken up with dizziness, a cough, and a fever. His mother, Caroline, starts an exam using the Ochsner Anywhere Care Health Kit. First, she takes an image of his throat using the tongue depressor. Next, she records Michael's lung sound using the stethoscope. Now she records a video of his eardrums using the otoscope. Built-in guidance helps Michael's mom guide the device safely into her son's ear canal and lets her know when the eardrum image has been captured. Using her smartphone and the Tyto app, she sends the exam data to the Ochsner Anywhere Care app, so it's available for her doctor to review during a telehealth session. She then launches her Ochsner Anywhere Care app to begin a telehealth visit for Michael. The app asks her which doctor she'd like to see and which exams she'd like to share with the doctor. She then begins her visit with the physician. Michael's doctor starts the telehealth consult, reviews the examination data provided by the Ochsner Anywhere Care Health Kit, and discusses her findings with Michael's mom. Having diagnosed an ear infection, the doctor submits Michael's prescription to the pharmacy for pickup. Michael is spared a visit to the ER, and his mother has peace of mind that he received the right diagnosis and treatment, all from the comfort of home. The Ochsner Anywhere Care Health Kit, powered by Tyto Care. On-demand medical exams with your doctor, all from the comfort of home.
Okay, so
when your
hold on just a second. Oops, went back just 1 second. We get to where we need. All right, so having that, you can see you could do a lot of things. I wanted to show that to be able to show you where things are going right now. Most folks do not have access to that right now, but that's coming. You can bet all of these platforms are going to be able to roll those types of things out. And for patients who want to have that type of access to their provider, they're going to get those kinds of things. They can actually use their health benefits, you know, the extra money some folks get in their jobs to use HSA for that to pay for it and things like that. So integrating with your current software, being able to use a blood pressure cuff to be able to track a patient's vital signs, that's good not only for just planning on tracking a blood pressure population. But for every single visit that you do, if they can upload their vital signs directly into your system, that's a pretty good deal. And so much of what we do relies on accurate vitals. So kind of think about that. If you can get one with that, that's a big thing. So we need to look at methods for intake and consent. So when folks go through our platform, they're able to sign that they, consent for the visit with going through all of the different laws that each state has. So there's some actual verbiages that we use. One here is for Texas that I copied, and one for Louisiana. And actually, I will show you a template. My template I use in my clinic. It's an exact verbiage of what is on the bottom here for Louisiana. The virtual waiting room concept, I want to go through that. Right now in our particular system, people just land in the waiting room, and I worry because I'm worried, do they know if they're in the right place at the right time, et cetera, because it's just, them, because I'm not always on time in my clinic. I don't know about you, but we're trying to work on having a messaging at the bottom, or being able to have our nurses pop into the visit and say, because our nurses right now can see when a patient logs in, they can see on my schedule, that the patient is there. So we're trying to work on these different types of features. We don't have that yet, but we're working on it. So kind of think about those when you're looking at platforms, because some do already. The scroll feature at the bottom, that's one where you can actually put specific things that you want to tell your patients, if it's marketing or get your health screenings, your mammogram, your flu shot, and that kind of stuff. Does it have a scroll feature at the bottom? That's kind of nice. And I was going to go through this, but in the interest of time, you guys can go back and look at this video. It's basically a lot of the features of MyChart. That's the one that we particularly use, which is an offshoot of our product of Epic. And there are various things that you can do with that. But I did want to take you through and show you something that I feel very strongly about patients' love of being able to interface with me and their healthcare provider in general through the MyChart or through some particular app. Okay. So let me pull this up. I'm actually going to take you into mine. I didn't click on the code. I'm sorry. There we go. What I'm doing, I'm taking you into my personal MyChart. Okay. You saw I just logged on, and in this, I can go in and easily click on schedule an appointment. And I can either do this online on a computer or through the app. And I'm going to look for a same day appointment. And this question down here, you can be seen virtually or continue virtually. Would you like to continue scheduling as a virtual patient? So what it's trying to default is trying to prompt me. If I was just looking for a visit with my doctor, I might not even know that he has those. So we have it set so that we can show that you can do that now. So I'll click yes. And next it's going to bring up some specific questions. I will need to have the MyChart app. Well, if I'm already, doing it through the app, I have the app. And it talks about I'll need a smartphone or a tablet. Next, it's asking permission to process my claim, which that's what we do whenever we have people check in our front desk. And then next is, will you be located in the state of Louisiana? The laws state that you have to be licensed in the state where the patient is receiving care. So here we're getting them to click through that they will be in the state, and we're documenting that. And then I can pick my region. My doctor is in the Baton Rouge region. And from there, it'll pull up all of the doctors in the Baton Rouge region. Well, it has been set so that it knows either my PCP, which is Dr. Sparks, or if someone's closer to me. So we want people to be seen geographically by their local doctors. Okay. So, oops, I'm sorry. Let me click that and then continue. And here I can say I could be seen tomorrow at 1 p.m. Okay. I'm not going to click the button here, but that's what I would need to do. And I can book that online. Now, when I do that, actually the next step in that is that I get a message and I answer an e-pre-check. So it asks me various questions, and some of those are my symptoms. So believe it or not, all of that HPI can be brought into my note when the patient sees me. And I go through a complete review of systems that can be brought into my note when I see the patient. So all of a sudden, pretty much half of my note is done before I even see them. And it's in the patient's own words. So that functionality is a godsend to me in my efficiencies and accuracy. So I love that feature there. Okay. I'm going to go in from here. I'm going to cancel scheduling, leave that page. And I wanted to go through a little bit on messaging. Specifically, I have a health coach. Okay. And she is telling me I'm due for a visit. All right. I just got that message today. Okay. So I need to book my appointment. Should have used that 1 o'clock, right? Anyway, so also through the portal, you can go in and see your lab reviews and results review. And on this part, this is really nice. When I'm going through my e-pre-check, I'm prompted to go through all of my medications. So I say whether I'm on this or not on that, and actually it strikes it such that when the provider sees the patient, it says the patient has said they're no longer on this medicine. So then I can reconcile their medicines. But that whole process, instead of having the nurse do it, the patient's actually doing it. And so that saves my nurses some time. Okay. So let's see. And I wanted to briefly go through the automated blood pressures. Over here on the side, there's something called Track My Health. So in Track My Health, I can go in and just on the fly, I can click enter a blood pressure. And so say I'm going to be seeing my doctor, I can upload my vital signs that I just took manually. Okay. So you see, I can go right up here and add new data. But if I have one of those really nice automated blood pressure cuffs that's Bluetooth to my phone, I can go in and manage various accounts. So I had mentioned the Withings company. I'm linked up so that actually I have a scale that is linked up to my MyChart, okay, at my house. I actually have my iHealth. I'm on the blood pressure digital program with Ochsner. So all of my blood pressure vital readings go to them. So it's very nice so that my doctor can keep up with me. The reason why I'm making a big point of that is imagine what it's like when you can all of a sudden see a patient for a blood pressure or diabetes problem in your office. You change their medication. Historically, I used to have people just send me a spreadsheet. It would end up in my paper inbox in my office. I would sit down, evaluate that, look in their chart, manage their medications, and make a treatment decision about what to do. Well, now that I am able to capture all that electronically, I can plan for the patient to see me virtually. And I'm able to review 2 weeks of data on their medication change instead of what is their pressure right then in the office if I happen to bring them back in. Okay. So I feel like I'm dealing with more data. I'm able to reiterate all of the treatment goals, diet, exercise, and all those other kind of things. So I feel like it's a more effective way to deal with those types of problems. And that's the chronic care management piece that I've just loved doing through telemedicine. So provider needs. I've talked a little bit about getting some of that information, your HPI, review of systems, medication reconciliation, vital signs uploaded, all of those kind of things are a bells and whistle type thing. Being able to capture photos, we've talked about that. Templates, I'm able to document directly into my program right from the visit. And being able to e-scribe and send the patient an after visit summary. I can send their letters to them, their excuses, etc. I can send all of that. If they hurt their back, I can send them a copy of their exercises straight through there, and they can print them out at home. And I can also afterwards be able to send all of my chart to my team. I need to be able to route that appropriately, because imagine how many things you may order, and if someone doesn't go in and schedule it, it was all for naught, and the patient doesn't get what they need. This is actually a picture of me photo capturing during one of my visits. We're actually able to, when I snap the button on the app, that actually can be pulled into the patient's chart. So I've done things not only like rashes and things like that, but I've documented low back pain patients bending over, touching their toes, doing a straight leg test, you know, those kinds of things. I've snapped photos like crazy and be able to document that and pull that into my notes. Here's a simple template that I use for every telemedicine note that I document: patient location, the chief complaint, and the time spent. But if you notice, go back and compare to that law that I showed you from Louisiana. That is exactly the law from what I showed you before. And it's also what the patient signs that they understand, okay, when they're getting into the system. Of course, billing. If your program can do billing and interface with your billing system, that's awesome. Then you can integrate online payments and things like that. But again, it is not necessary. You know, you can get started with a simple program like we talked about earlier. I want to go briefly through resources, and I'm going to highlight just one of them because you can click on these later. But this Texas Medical Association vendor evaluation form, guys, this is gold. Thank you, Danae, for sending this to me. She's the one who found this. But this goes through and it just about asks every question you need to think about in your mind. There's a functionality section with all those questions. There's training, support and maintenance, pricing, etc. It goes through all the things that you need to basically answer for yourself when you're looking for a telemedicine platform. Here's some other references you can go through. And of course, you can contact us to contact the folks at Well Ahead, and that wallpen.org/telehealth. That is where all of these videos will be posted. This is a 16 lecture series that we will be doing. So we're going to definitely get into the weeds of what my experience has been. And of course, you can contact me through my email or on Facebook if you would like to. So I will end the show on that and then try to field any questions that you guys may have.
All right, I don't see any questions yet, so we'll give it a minute, see if we get some into the Q&A here. Let's see, I got a comment. This is just fantastic training. I'm so grateful for you doing this, from Mr. Randy McKinney.
And where is Randy located?
Randy is with LPCA. He's their telehealth project manager.
Awesome. Well, thank you for that compliment. I appreciate that.
Yeah, and we've worked with Randy for, well, I've worked with Randy about 1.5 years. I've only been here 1.5 years, but I know Tracy's worked with Randy for many, many years. Miss Lillian, I completely agree with Mr.
I'm not accustomed to Tracy being so quiet.
I was on mute.
I muted her when she joined to
Smart move.
Well, thank you everyone so much. Please put in your questions you have, and also give feedback to Danae and I how you think this can be better. Not only the series, but the services that we provide for you guys overall with telemedicine. You know, what's not being met? What's the need that's out there that's not being met? What kind of education do you need? Things like that, because we are really trying to structure this program, and it's a good time to give feedback and input on that, because we're developing all this as we speak.
Yeah, the lectures are not all written yet. So the presentations are not there. So we can definitely mold this into what you feel you need. I'll give it my best shot to be able to teach you what I know about your needs, and maybe guide you in a way that would be helpful.
Yeah, and you can reach out to us directly via email. Our email addresses were listed on that previous slide, or pretty much anywhere on the Walpen website. There's a form at the bottom that says submit questions. So any page that you happen to be on, if you put telehealth in the text, they will send it to me. And then if you go to the walpen.org/telehealth page, that one I think will directly come to my email address. So any comments, questions, thoughts, concerns, recommendations, all of that, please go ahead, submit it there. And we'll get those emails and we'll address those. So I'm not seeing anything else. So if Tracy or Dr. Hudspeth, if you have any comments before I do my little closing announcements. Oh, look, I have a question.
Good.
So during the hurricanes, many providers were displaced in different states. Can you speak about the law in practicing across state lines?
That if you were displaced, then you can see your patient anywhere that you are. So, but if your patient was sent across state lines, you shouldn't be doing that unless if you're licensed in that state where they are. So now for this disaster of the pandemic, and you know, I'm fairly close to Mississippi. Mississippi did have an emergency program where they allowed us to just send in a sheet of paper, and I got an emergency license to be able to practice in Mississippi early on in the pandemic. But I think that's going to end this month. I think they're ending that. So I'm not, and I do have patients that live in Mississippi, and I've seen some of them up there, but I won't be doing that after that. I'm not reapplying for another license at this point. So that's my understanding. Do you guys have any other understanding besides that?
No, that's correct. The law around licensure is based on where the patient is located, the originating site. So even if you as the provider are displaced, as long as you're licensed where the patient is, then you're okay. So that shouldn't be an issue. And then you're right, a lot of states did have emergency licenses where you could get them quickly and easily.
Yeah, so if we have another hurricane, now that we can do this, you know, in this manner, probably something would be set to where it'd be legal, just like they're doing everything else for non-HIPAA compliant platforms right now in the short term. So.
And just a note, Dr. Hudspeth, I would double check on the if it's going to expire, because we've seen something from the federal government that indicated that the public health emergency, they're expecting it to go through 2021. Oh,
okay. Well, maybe.
So, and it specifically mentions telehealth in there. So okay. I would double check that. Just, I think they're thinking about the changes that have been made in telemedicine, and you've got to make some decisions of how we can go forward, you know.
Right. Yeah.
So
well,
there should be more publicly released on that in the next week or two.
Yeah. Well, I think a point on that is, if you're thinking about doing this, you are not too late to the game. This game is just getting started. So jump in, you know, figure out where you want to jump in, but jump in and just start doing some. You're not too late to the game, and it's not so complex that you can't figure it out. So I hope what we've talked about today gives you a good idea of a platform to start with, and we can start moving forward.
Let's see. We have a question here. Each of these segments are so full of a lot of new topics. Could we have a short Q&A at the beginning of each successive session for any questions we may have about the previous session?
I'm very willing to do that. I would probably think that we should only record. I don't know. Would you want to record that too? I don't know.
I think what we would probably do is we could have a little Q&A before. We could just type those answers in writing as an FAQ.
Yeah.
We could post that to the website.
Okay. Well, however you want to do it, I'm very fine doing any of that. Whatever you want to do is fine with me.
Yeah, so we can plan maybe the first few minutes, 10, 15 minutes of the next session. We can have kind of allocated for that.
Okay, that'll
So
be great.
If you want to hear the Q&A, make sure that you join us on time.
That's it. That'll be wonderful.
Well, we are right at 6:30.
We are on time. We are at 6:30.
We are right on time.
Yeah. So thanks again for joining us. As a quick reminder, the slides and the recording will be on our website at walpen.org/telehealth. You can also submit questions at the bottom of that page again. The next webinar will be at 5:30 p.m. on Thursday, February 11th. So 2 weeks from today. And we'll talk about the telemedicine pre-visit workflow. Please feel free to reach out to us with questions at any time in the meantime. And thanks and have a great night.
Good night.